Healthcare has always been one of the most critical pillars of human life, directly impacting how we live, how we heal, how we sustain our well being. But today, healthcare is not just evolving, it is reimagined. We are entering an era where technology is no longer just supporting healthcare, it is actively shaping it. Artificial intelligence is transforming the way diseases are detected, diagnosed, and treated. From identifying patterns in medical imaging to predicting health risk before symptoms even appear. AI is enabling faster, more accurate, and more informed clinical decisions. And that is exactly what today's session is about. AI in healthcare, from diagnosis to decision making, is all about. Across the globe, we are witnessing a powerful shift. AI powered tools are assisting doctors in making critical decisions, reducing diagnostic errors, improving patient outcomes, and even optimizing hospital operations. But as promising as this transformation is, it is also bringing important questions to forefront. Can we fully trust AI in life critical decisions? And how can we ensure that these advancements are accessible, reliable, and beneficial for everyone? Good afternoon, everyone. This session is being hosted as part of our ongoing NextGenCon webinar series, where we bring together healthcare professionals, technology experts, innovators, and thought leaders to explore how emerging technologies are reshaping industries. Our goal is simple to bridge the gap between emerging technologies and next generation of professionals. I extend a warm welcome to our guest speakers, respected committee members, organizing team, founding members, and all the attendees who have joined us today for this webinar hosted under the banner of NextGenCon Global in support of the India AI Impact Summit that concluded recently. As the moderator of today's session, I am Bhanupriya Singhal, Project Head, Operations and Execution at NextGenCon, where I work closely on building and executing initiatives that bring together leaders, innovators, startups, and young professionals to engage in meaningful conversations uh, around emerging technologies, innovation ecosystem, and future of work. To begin our discussion today, it is my pleasure to introduce our guest speakers. Our first speaker today is Dr. Suresh Mathur, a highly experienced medical professional and former senior medical officer with the Rajasthan state government. He has served as a chief medical officer at leading organizations like Binani Cement and Ultratech Cement, with a specialization in industrial health. He is currently contributing as a Chief Medical Officer at MedSafe Health Insurance TPA Limited. Welcome, sir.
Thank you so much. Thank you so much, Banu.
Our second guest today is Dr. Sheena Arora, a renowned dermatologist, cosmetologist, and dermatosurgeon with over 10 years of experience. She has specialized training from leading institutes like Kasturba Hospital, Manipal, and St. John's Medical College, Bangalore. An award winning expert and member of IADVL, her expertise spans clinical dermatology, aesthetic treatments, and advanced skin procedures. Welcome, ma'am.
Thank you, Bhanu.
We are truly pleased to have both of our speakers with us today. Now, I would like to request our esteemed speakers to share a few opening remarks on today's theme, AI in healthcare from diagnosis to decision making. Over to you, sir.
So, should I start? Sheila?
Yes, sir. Yes, sir. Sure, sir.
Thank you. Thank you so much.
Yes, sir.
So, Banu, today's topic is very interesting. AI in medical healthcare. It is really a game changer in the medical care. But there are a few concerns also, or along with this. First, we'll talk about the positive things of the AI in the medical field, and then we may discuss the shortfalls of this AI in the medical fields, right? So, uh, as far as this medical field is concerned, it is related to the human emotions also, right?
Yes.
But first we'll talk the better part of the AI, because with AI we can really arrange all the datas and analyze the datas in very short period, and that will help us in developing many things in medical science, like in medicines, where we go for the long trials. Here also we can use AI. Then there are a few procedures where we use the AI. Then in making the diagnosis, although we don't depend upon the AI for making the diagnosis, but it helps us. It really analyze the data faster, so they help us in the, diagnose the people. So in that way, AI is very helpful in medical science. So over to Sheena, you are a surgeon, so you can better say how your surgery uh,
Yes, sir.
is. Uh,
Yeah. So, Bhanu, shall I speak? Hello.
Yes, ma'am.
Okay. So, yeah, sir. So, I think we have become an AI augmented practitioner, sir. I think so. New term for the practitioners, I think AI augmented. Why?
okay.
Because, yeah, yes, sir. So, I think like starting from the documentation work, like patient data, entering the patient details and all. So, it has reduced our 70% of the workload and ease out our burnout. And I feel even for the diagnostic purposes, like if we are confused if this skin lesion is cancerous or it is not cancerous, or whether it's a wart, whether it's a skin tag or mole, we just we have various apps for the skin lesions. We just enter the picture, the image, we can easily make out. But yeah, as sir told, we can't be totally relied on the AI.
Absolutely, absolutely, Sheena.
Yes,
Yes,
Because
sir.
it really helps us only.
Yes,
It
sir.
replaces our clinical diagnosis.
Correct, correct, sir. Correct, sir.
Because there are many situations where you have to consider many things other than AI.
Yes, yes,
Which,
sir. True, sir.
so we can't totally depend upon AI, but AI has really did a tremendous job, because
Correct, sir.
it has reduced the timing. That
Bill,
is,
yes, sir.
and as you rightly said, data management.
Correct, sir.
So
Yeah.
this is really a dramatic thing AI is doing.
Yes,
And
sir.
AI in preventive medicine, AI has the tremendous role, because the
Correct.
data collection and prediction of the diseases.
Prediction of the disease.
So
Correct.
in that area, our AI is doing wonderful job, right?
Yes, sir.
There we can use there the use of AI is really very good. And
Correct.
data analysis obviously is the
Yes.
major part of this AI.
Correct, sir.
But now, how do you say about you are a surgeon, dermato surgeon.
Yes,
So,
sir.
how do they use AI in surgeries?
So
Because
surgery only to differentiate, sir, like whether this thing. But sir, yeah, histopathology is the main diagnostic thing, sir. We can't be totally relied. Only if we want some other differentials of those things, we can put an image in that AI app, and we can
yeah,
get the other what all DDs we can put.
you can put, yeah,
Yeah.
makes your things faster
Yes,
and
sir.
you everything at a glance.
Correct, sir.
Otherwise,
Correct.
you need to go through the books and everything. So,
Yes. So we
uh,
just now pick up our phone and then put the things, and then you get a lot of things, and then it's just an sir augmented part, but not can be totally relied on AI.
is allowed on the AI, because
Yes.
medical profession is, as I said, medical profession is related to many emotions and many different situations also.
Yes, sir.
Uh,
Yes, sir.
so your relations between patient and doctor, and
Yes.
doctor and relatives
अगर
of
जो
the.
मैं तेरा सा जोड़ लगाया मैं हाँ
Sorry, but you wanted to say something?
No, no. I think so. I think some sound error was there. I think so. Yes.
Oh, okay, okay.
Yes.
So this is how we can use AI. If we
Yes.
use it smartly, it really helps us a lot.
Correct, sir.
yes. That's a very wonderful start of today's session. Yes, I believe that really helps to set the context of today's discussion at how AI and digital innovations are transforming the healthcare and
Yes.
ecosystem. To explore this further, I would now like to move on to our conversation and discuss how AI is shaping the way diagnoses are made, decisions are taken, and patient care is delivered. We would also like to keep this session interactive. If anyone from audience has questions during the session, please feel free to drop them in the chat. So, for my first question is from you, sir. As someone who has witnessed the evolution of diagnosis, do you think doctors might start relying too heavily on AI recommendations?
I won't say the doctor should rely heavily on this AI. They
Yes.
can rely, but they should they make their decision of their own, not solely dependent upon the AI. AI will give you the data, which
Yes.
is very faster in collecting the data, and as Sheena said, differentiate the diagnosis. What we
Diagnosis.
call it differential diagnosis, right? So in
Yes.
that AI helps us, but final decision is always is of the doctor. He should make the decision because there are many things, as I said, there are many situations, there are many variations. So that only doctor can see. AI can't tell you about that. The real
Yes.
time picture, doctor is looking that. AI will give you whatever you have fed to AI,
What
right?
already data is fed in the app, correct?
Yeah.
Like,
App
it's a
will
machine
not
learning.
real time picture. So it is
Yeah.
always doctor's decision is to be the last decision, and he should make their own decisions, not solely dependent upon the AI. Nowadays, what young doctors are doing, I'm very sorry to say. Doctors, they may write their thesis through AI, they make their everything through AI. So this should not be done. They should use their mind because AI really, decline your critical thinking,
Correct,
right?
sir.
So we should not solely dependent upon the AI. So
Yes.
that is it, that we should not solely dependent upon the AI when we are making the diagnosis, right?
यस ट्रूली सर बिकॉज जब तक उसमें एआई को भी हम सिखा रहे हैं जब तक उसमें ह्यूमन डॉक्टर का पर्सनल नॉलेज वहाँ पे प्रेजेंट नहीं होगा देन डायग्नोसिस हम राइट डायग्नोसिस नहीं बता सकते हैं वहाँ पे
Exactly. Exactly.
जी so my next question is from you, ma'am.
Yes.
What inspired you to enter the medical field, and how has your experience evolved over the years, especially the rise of healthcare and AI in healthcare? Like you are in experience of 10 years in this field,
Yeah.
and back then when you have started, there
Yeah.
was no, there
Yeah.
was AI, not that much that how it is
Correct.
evolving. So,
Correct.
what
Correct.
inspired you to be in this field and changes you have seen?
Inspired, Bhanu, it was mainly I had a profound desire to help others. Like doctors are basically for helping, right?
Yes.
And I there was I have my uncle who was a surgeon. I was really inspired by him, and I used to, and even now I love to read books, articles, and that I had a love for biology, science. So that's where I land up in medical field. But yeah,
Yes.
I'm very happy. And yeah, when I started my MBBS. That time there was no AI. Like
Yes.
there was, because AI started in 1956. But now with more evolution in the AI techniques, we are now getting the apps. It has drastically helped. Like earlier I told, in data documentation and all, it has reduced our workload so that we can focus on more of the patient care towards. So
Yes.
enhancing our diagnostic capabilities also. Like we were thinking whether it's malignant. Now we get another diagnosis with the help of AI, which earlier, yeah, we were thinking. So yeah, it has really experienced our medical knowledge as well. I feel so. There are few those negative, but I think that we'll discuss later. But yeah, it has really helped AI.
Yes. बहुत क्विक बहुत फास्ट एक इवोल्यूशन
Yeah,
एआई के साथ
yeah,
मेडिकल हेल्थ केयर में
yeah,
भी
yeah, yeah, yeah,
सीन थ्रू
yeah.
So my question is from Sir, who has an experience with the government side and on the gaps between the rural and urban areas. Sir, in a country like India,
Yeah, please.
I think.
I think one we have,
Yeah. I
yeah,
think it's connection.
offline now.
Yeah.
Offline. There's some glitch in network, I think.
Yeah.
Good morning, Dr.
Um, just wait for 5 minutes. Bhanupriya is connecting again. Okay.
Hello, sir. Good afternoon. So, up until Bhanupra ma'am is coming back, I have a quick question if that's okay.
Yeah,
Thank you so much, sir. So, basically, people often say that experience matters more than technology in healthcare. So, do you think AI challenges that belief?
sorry, what?
Sorry, shall I repeat the question?
Yeah, yeah.
So, people often say that experience matters more than technology in healthcare. So, do you think AI challenges that belief?
Absolutely, absolutely. People are going for the AI nowadays. See, experience, as we were discussing, because the doctors are seeing the real-time picture of the patient, right? Not AI. Now the people, what they do is they really go through, they Google their diseases and everything before they consult a doctor. So that is what you wanted to ask me, that experience of the doctor, they should not overcome AI, right?
Right, sir, right. Absolutely
Because
clears the question.
because
Um,
experience is something which doctors gain after over the years they practice, and
Definitely, sir.
there are
That is a
many,
trust building thing.
exactly, the trust building, and there are many diseases which change their course, right? Initially, if, if I take the example of malaria, they are written in the books that malarial fever is always come with the chills, is associated with the chills. यानी ठंड लग के बुखार आएगा तो मलेरिया होगा.
हाँ जी
But
सर, हाँ
in
जी.
many cases we have seen that they are malaria patients. They doesn't come with the fever with the chills. They come with some other symptoms. So this is the experience, where the experience of doctors that speaks. They diagnose malaria with the help of their experience, right? So AI can never overcome the experience of the doctors. What I feel
Right,
is
sir. Yes, the perspective is to build कि भी AI is to enhance and help, not to replace the experience.
exactly not to replace the experience. Exactly, that can help you. That can help you a lot. We can't deny that. It can help you a lot, but it can't overcome or like surpass experience of the doctors.
Yes, sir. Thank you so much for your time, sir.
I will like to add to Dr. Mathu's statement.
Yeah,
Basically, AI can help in differential diagnosis because sometimes there are a lot of differential diagnosis in medicine. I'm a man from medicine, so
yeah,
you can sometimes you are lack some of uh, causes basically. It helps, but as Madhu says, your experience matters a lot for patient benefit.
Exactly, sir. As Sheena rightly said, the differential diagnosis, she mentioned this point that they put a picture of the particular lesion of the skin in the app, and that app gives you
Yes.
more pictures of the diagnosis. So, exactly what you are asking is exactly helps in differential diagnosis faster.
Yes, sir.
to listen to all of you.
Yes, sir. To continue with ma'am.
Yes. Yeah, Banu. Yeah.
Ma'am, yes, my question is from you. If AI can analyze thousands of medical cases in seconds, what remains uniquely human in healthcare, or are we simply moving towards faster but not necessarily better healthcare?
See, Bhanu, for any diagnosis, like I'll tell you about the skin dermatosis, like any patient come, there is thorough history which we take, then we do the clinical examination, and then if required, we do the blood investigations. And then mainstay remains the biopsy if we are not clear about the lesion. So, how can we see when a patient comes in my OPD? It takes me around 15-20 minutes. I talk to the patient, I build my trust. They talk to me, they give me their history, whatever they have used, any side effects or something that all needs to be taken care of. So, I think then human touch remains the most important thing that can't be done with the AI. So, I feel AI can't replace the human healthcare. I think again she has left.
Yes, ma'am.
I think there was some glitch from your side. Yeah.
Yes,
Mm.
actually, there's a little network issue
Yeah.
on
Yeah.
my end. I'm
Yeah.
really very sorry for that.
Yeah.
बट यस आपने बिल्कुल जैसे अभी आपने कहा कि ह्यूमन के उनके साथ पेशेंट्स के साथ इंटरेक्ट
Yeah.
करना उनको कंफर्ट करना इज वेरी
Correct, correct.
इंपॉर्टेंट ड्यूरिंग
Suppose,
प्रोसीजर.
yeah, suppose Bhanu, if some adverse event, something like the patient has done AI thing, so there's something called as AI dermatologist, like
Mm.
skin scanner. So if they what they have to do, they have to insert, like they have to put their picture, and they'll give you the analysis, they'll give you the treatment. If something adverse event happen, then who is accountable? No one.
No.
So right. So I.
Okay.
Yeah. So now, if something happens, now doctor, yeah, then that doctor has given. So that's different. The AI cannot replace.
Yes, AI cannot replace the human
Yeah.
doctors.
Yes. Yes.
Yes, very well said. My next question is from Sir. Sir,
Yeah.
for students entering healthcare today, what skill beyond medical knowledge? Sorry, there was some mis- interruption in between.
Okay,
I'll
please
ask
go ahead.
the question
What?
again.
Yeah.
For students entering in healthcare today, what skills beyond the medical knowledge should they start developing to stay relevant in AI-driven ecosystems?
In AI, right, right. My humble suggestion to them is don't solely depend upon the AI. Develop your own skills. Then you use AI smartly. That is the take of the what I feel is right, because nowadays
Yes,
what students does it, they go for the easier job, right? So what they do is, as I initially said, when they make thesis, they help. They totally copy paste. They do copy paste of the AI when they make the decision. They don't apply their brains. So this should not be done. They should use AI, but smartly. This is my
yes.
humble suggestion, because that will spoil their career. What I feel is, because if they don't do hard work here, they'll not be able to do hard work in the field. As Sheena said, when she see patient in OPD,
Correct,
they
sir.
through, they Google their diseases and they come to them, then they'll start teaching you. मैम
So,
आपने ये कहा था, मैम
so
आपने
I'll give you one example. So there was one patient, like I diagnosed with the tinea, that the fungal infection. So he told, yeah, ma'am, that similar chat GPT told me the same thing. So
same
that
thing.
was tinea. So they'll take the treatment, sir, they'll apply everything, but still, sir, for how long the treatment has to be given, for how long the creams has to be applied. That is
Exactly.
very much important.
That ChatGPT or AI will not tell you
Yes,
because
sir.
they are not seeing the disease, how
Yes, sir.
improvement has been done, or
Correct,
whether
sir.
things are improving or not. It is
Yeah.
only the physician or the doctor will tell you who is
Yes.
treating the patient.
Yes,
Even,
sir.
it happened with me also. People used to Google their disease and they came to us कि सर ऐसा ऐसा हो गया ये सब है ये मैंने तो देख लिया. Then I used to say them यार तुम हमारा एग्जाम लेने आए हो या इलाज कराने आए हो.
Yes, sir.
So it happens many times, you know.
Yes, sir. Yes, sir.
Listen to the students, they should use AI, but
Yes,
very
sir.
smartly. They should
Correct.
not depend. They should not solely dependent upon the AI.
On AI, correct.
Yes, ma'am. They are all not solely depend on the AI कि सब वो खुद से पढ़ के आ रहे हैं, वो खुद अप्लाई करके आ रहे हैं, देन उसके
सब
बाद
कुछ हो रहा
बिगड़
है.
जा रहा है, देन डॉक्टर के पास आ रहे
हाँ,
हैं कि यार ये बिगड़ गया, हमने उसको यूज किया और ऐसा हुआ. तो
हाँ,
यस, दैट्स वेरी यूज ऑफ एआई की आपको वेरी केयरफुली, अगर आप मेडिकल में उसको यूज कर रहे हो तो बहुत केयरफुली
Yes.
आपको उसको यूज करना
हाँ.
चाहिए. इट रिलेटेड टू योर हेल्थ.
Medical
Correct.
health especially. In other fields, AI doing wonderful things.
Mm-hmm.
AI doing miracles in other fields. That is acceptable.
Yes, yes. So my next question is from Sir. Sir, do you see government increasingly relying on AI for public health decisions, such as disease predictions or outbreak management? Could this dependence become a strength or a potential risk?
See, health in rural areas, as a health, we can divide health into two like major headings: preventive health and curative health, right? So far,
Yes, sir.
preventing health is concerned, government is doing uh, government is doing wonderful job. They are running many programs, but they all programs
Hmm.
are based upon the data collection, right? And analysis of the data collection is
Yes.
done by the AI. So in that way, AI is
Yes.
very good in analyzing the data, so they can predict the
Hmm.
diseases. So in that way, government is doing good, but still many miles to go on. अभी भी है ना? So they are doing good, but in the
हाँ.
curative health, when you compare rural and urban health services, there's vast difference. You know, even
Yes.
in the urban area also, if you see the scenario, if we, in urban area also they are not using AI vastly. है ना? There are some pockets they are using the AI. So in the rural area, so it is very difficult to penetrate in that particular field to use AI. But yeah, government is using AI in preventive health. Preventive health they are using. They are making their policies with the help of AI. Prevent the disease and the prediction also. Like in the corona also we saw
Yes.
they predicted the second wave, then
Yes.
third wave, and first wave. So it was very unexpected. Nobody knew that what it is, right? So we really
Yes.
handled that. We have handled those patients in wards in the so everything was like that. But subsequently, second wave, third wave, they used the AI and they predicted that, and the results is
Find
there.
the cure before the time.
Yeah, before the
Yes.
time they could take.
Yes. 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 AI has helped so much during the corona for second and third wave कि हम पहले से predict हो गया था कि ऐसा कुछ
Prepare
आगे
for that.
आएगा.
Yes, exactly.
एंड उनके ऊपर काफ़ी रिसर्च करके डॉक्टर्स ने काफ़ी अच्छे सॉल्यूशंस और क्योर्स उसका निकाला उस टाइम पे, एंड इट प्रिवेंटेड अस फ्रॉम वेरी हजार्डियस इवेंट्स ऑन दैट टाइम.
In that, what I wanted to add one thing:
यस सर.
evaluation of vaccine of corona. that was solely, the trials were solely dependent upon the AI because
Yeah.
there was no time. Because अगर कोई भी vaccine if we develop or medicine if they develop, the it take long time to develop that because the consequences are long term consequences आप उस समय नहीं जज कर सकते कि अब ये
हाँ.
होगा नहीं होगा. Like it take time, इतना time निकलेगा तब पता लगेगा. But
Hmm.
through AI they could
अब आपको
predict.
दिन में हो गया हो सकते हैं टाइम नहीं हो गया कर ला क्या हाँ कर लो
हाँ, in developing the vaccine, AI had very good.
Yes, sir. Uh, I would like to request the attendees, please keep their mic mute so that we can listen to our guests and what they are saying. Thank you. Yes, sir. You have said that AI ने हमको बहुत ज़्यादा help किया उस time vaccines के लिए.
Yeah,
So
developing the
उस
vaccine.
time panic situation में उसको cover करने के लिए AI was a very good helper to
Yeah, yeah.
everyone.
Very good tool to help us.
Yes, very good tool to everyone. Okay, the next question is from you, ma'am.
Yes.
Do you personally use any AI-based diagnostic or decision support tools in your practice? What has
So
your experience been like so?
So I have a facial analysis machine in my center.
Okay.
So that's, but I don't rely upon that. It's only because patient ask him, "Do you have that machine?" That's why I have kept that machine. So what we insert, the patient puts his face inside, and they'll tell how much pores you have, how much hydration, how much wrinkles, fine lines. They just get a fair idea about whatever, like there's a picture the face is showing. But even there is something called as trichoscan. That's basically for the hair density calculation. How much you ever put a trichoscope over the patient's heads, and we measure the how much hairs you have, and then we can even show them like after 3 months of PRP or GFC treatment, you'll have this much improvement. This is just to give an idea. The 3D picture we get, this is the pre picture, this is the post picture you'll get from the GFC. So I use, and there is something called as robotic hair. We do hair transplant in our center, but we don't have robotic hair transplant. There is in Surat. There's something artars. So what that robots do, they take out the follicles. But yeah, doctor has to manipulate and everything. So I feel AI is doing good, but if we use adequately, yeah, they are very helpful. So I have skin analysis that I use, and then even for differentiating if there is the lesion is benign or malignant something, just to augment our ideas.
Yes. Also, ma'am, there is a thing अभी market में Korean skin care, and it
Yeah.
also has some kind of skin treatments and everything are
Yeah.
going on
Yes.
that
Yeah. Yeah.
scan
Yeah.
and treatment. They are
Correct.
very
Correct.
much in the market.
People are very much
So,
influenced by the
yes,
Korean. But I
Korean
explain
skincare.
them, yeah, Korean skin. But I explain them. See, we are Indians. We can't get the Korean skin. It's not possible because it depends upon many other factors like your genetics, about your
Yes.
environment where you live, and so many in work and so lifestyle, your diet, your sleep.
Yes,
But they are ready. They want just Korean skin.
that glass-like finish we
Yeah,
have.
yeah. Yes.
Any particular reason for that?
So
Uh,
the Koreans have very beautiful and nice skin, sir. So today everyone is so much in the market. Also, sir, there are Korean glass facial.
Yeah, this is the feminine topic. I should not indulge.
We see a lot many patients. They'll tell, yeah, they have got the Korean products, and they are so expensive. They'll spend also, sir.
Why to say underrate Indian skin? Yeah.
I don't know, sir. The people they feel like they need to be more fairer, like Korean, like but they don't understand, sir. Actually, the more melanin
Melatonin.
is actually protecting you from the skin cancer.
Yeah, exactly.
That's more healthier skin. They don't understand, sir. They just want.
Complexion.
Yeah, yeah, yes, sir.
so,
It's all
and Yes, sir. Sorry to
Uh,
interrupt. What you are
yeah,
saying?
no, what I was saying that it all genetically fixed things.
Correct.
You can
Correct,
change
sir.
that.
Yeah.
Yeah, and one should not interfere in the nature's work.
Yes.
What I feel is this is my opinion. In
Yes,
in
yes.
in any case, you should not interfere with the nature's course.
Nature goals. Yeah, yeah. It's true, sir.
Hmm.
Sir, my question is for you. If
Yeah.
AI could predict disease years before a symptom appears, should patients always be informed, or could that early knowledge create unnecessary anxiety for patients and their families?
So, yeah, very good question. AI can predict few diseases, but it is not a thumb rule. There are certain enzymes, there are certain byproducts are produced in the skin or skin. Sheena is dealing with the skin or in the body, human body. If
Yes.
those things are developed in the body, AI can predict that if this thing is present in the body, this may lead to this disease. Not thumb rule कि अगर ये है तो वो होगा ही. It's not like that. It can help you. It can make you aware. It can really make you aware that you can take precautions to prevent that disease. It's not like a thumb rule that AI is telling you कि अगर ये चीज हो गया बॉडी में तो this disease will be there in future. But yeah,
Ye-
preventive in prevention, the patient can take care of those things.
And sir,
Yes.
I feel in AI, mostly the data is fed, mostly which is collect that is from the fair skin. I think if we put the lesion, they might even don't even like if we put the R because mostly the data is from I think the US fair
US, yeah,
skin
in the
people.
European countries, all those
Yeah.
fair countries. Yeah,
Yeah, yeah. I think in ours Indian skin color, I think they might even miss out the
yeah. In the those data like Indian data is very few or it's
correct, sir.
negligible.
Yeah,
So
yeah.
major part is from there. In the
Yeah,
medicine also, all the research it been done in European countries.
correct, sir.
All the means standards of the medicines, doses, and everything was like it was in the European countries.
European countries.
Used. In Indian if we talk about the doses of the medicine, like in
Mhm.
European countries, 60 kg is the average weight. For
Everywhere. Correct, sir.
in India, we get only 50 kgs is the
Yes, sir.
yeah. So average weight is 50 kg. So how can we match those standards?
Correct, sir.
So it is in all the means wings of the medical medicine.
Right.
Yes. As we come to end of this insightful session on AI in healthcare from diagnosis to decision making, I would
Mhm.
like to extend my sincere gratitude to our esteemed guest speakers for sharing their valuable knowledge, perspectives, and forward-looking insights on how AI and digital innovations are transforming healthcare delivery and clinical decision makings. Before we conclude today's session, we would like to open the floor for a short Q&A of our with our audience. If anyone from these attendees have any question, please feel free to drop them in the chat box. Meanwhile, people are asking their questions. I have a small question from both of our guests. So, ma'am and sir, what would you like to recommend to our attendees or the students who are going in the healthcare for their future professions? What would you want to add in this session for AI in healthcare, ma'am?
Sir, I want sir to answer. I think so.
Yeah, yeah,
Yes.
sure.
I want sir.
From sir.
Shina, you
No, no, sir. Sir, over to you, sir. Over to you, sir.
oh,
Yes,
thank
sir.
you.
Yes, sir.
uh, well, my suggestion, as I said, for the young doctors who are pursuing the course or they are young in the field, they should not solely depend upon the AI. They should use their skill So the critical thinking and the diagnosis is maintained, and they can do better. And keep this thing always in mind that AI cannot replace human brain and the feelings. Always you keep this thing in mind when you are in the medical profession. You use AI, smartly use that AI, and make your own decisions for the diagnosis and the treatment also, and the length of the treatment also, because you see the patient, right? So don't solely depend on the AI. But AI is a very good tool, very helpful in making the diagnosis and the differential diagnosis, as Tina said. Sorry, Tina, Sheena said. So this is my uh, closing remarks for this.
थैंक यू सो मच सर, वेरी वेल सेड कि हमें हमारा ओपिनियन, डॉक्टर्स का खुद का ओपिनियन एक वेरी इंपॉर्टेंट थिंग जो कि मैटर करती है हर डायग्नोसिस में और किसी भी ट्रीटमेंट में, कि कितना लेंथ उनको रखना है. यस,
Exactly.
वेरी वेल सेड सर. एंड you ma'am, what's your opinion and what's
Yeah.
your suggestion?
Yeah, as sir rightly said, everything like AI is a very like we can just use it and we shouldn't be relied upon that. And but people are mostly dependent on AI, what we have seen, because AI is mostly is fed by the data, whatever is entered, so we can't be relied. And I think human touch cannot be. That is the most important key. Whenever any patients come to you, you talk to them, you understand, because they have come for some problem. Nobody comes to doctor like that. If someone is troubled, then they'll come. So I feel human touch, the discussion, everything has to be done properly, that AI can't do. So yeah.
One more thing
Thank
I
you.
would like to, so if you
Yes.
give me 2 minutes,
Yeah, yeah.
one more thing I would like to add is, see, as Sheena said, that all the data are fed in
Fed.
or whatever it is. If any virus,
Correct. Yes.
store those data,
Yeah.
that can mislead your
Correct.
diagnosis, differential
Yes.
diagnosis and treatment too.
Correct, sir. Correct, sir.
So security, cyber security, what the word they are using nowadays,
Correct, sir. Correct, sir.
compromise, and that is not being like addressed in this whole situation. And
Correct, sir. The privacy, sir, is also hampered. So ethical guideline. Yes.
yeah,
Yes,
exactly.
sir.
See
Yeah.
also. And then when you are using robotic surgeries, you have
Correct,
to
sir.
be very cautious about that.
Yeah,
How
yeah.
it
Correct.
is working. You can't leave everything upon the robot.
Robots. Correct, sir. Yeah.
आपने प्रोग्राम कर दिया, उसने सर्जरी कर दिया, पेशेंट आउट.
Yeah, yeah, sir. Yeah, yeah. We can't do, sir, like that. Yeah.
You have to be very vigilant about that also.
Correct, sir. And I think, sir, some diseases like leprosy is more prevalent in South Asian. Like it's not there. So the data is not fed with those low prevalence diseases like leishmaniasis.
Yeah, exactly.
Yeah. So that. Yeah.
So they are the concern, right? There are
Correct,
a
sir.
lot,
Yeah.
there are a lot of concern with that. But yeah,
Yeah.
it is acceptable, but
Yeah.
smartly.
Smartly. Correct.
So now
Yes.
you can complete the session. Thank you so much.
Yeah. No.
Uh, Thank you so much, both of you, for those insightful thoughts. A special thanks, a special note of appreciation goes to Mr. Krishna K. Seni, founder and CEO of NextGenCon, for his visionary leadership and for organizing this impactful session that brings together the academia, industry leaders, innovators, young professionals on one global platform. Your commitment to fostering meaningful dialogues on emerging technologies and future ready skills is truly commendable, sir. On behalf of the moderation team, we also thank to our distinguished guests, participants, and attendees for actively joining and contributing to today's thought-provoking discussion. Your presence and engagement made this session more enriching and impactful. NextGenCon continues to serve as a platform for innovation, collaboration, and future focused conversations that bridges the gap between technology, education, and evolving needs of the global platform. We look forward to hosting many more such insightful sessions that inspire ideas, spark collaborations, and prepare next generation for the opportunities of rapidly evolving digital world. Thank you once again to our esteemed speakers, organizers, and all the participants for being part of today. Have a wonderful day ahead. Thank you, sir. Thank you, ma'am. Thank you, everyone, for joining.
Thank you so much.
Thank
Thank you,
you. Thank you, sir. Thank you.
Tina. It's a
Yeah,
good talking to you.
yeah, same here, sir. Thank you, sir.
Okay.
Yeah.
So,
Okay, okay, sir.